folks, this is the latest edition of Sin's Chat Corner television show. Today, I have a very esteemed guest who does some incredible, honorable, remarkable work, but I'll let him introduce you himself.
Hello everyone, I'm Dr. Jawad. I'm basically from Pakistan.
So, the first thing I want to talk to you about is kind of a generalized question. I live in the United States. I'm not in the same place you are, but I know that the standards and conditions of healthcare have changed drastically since the pandemic or even during it. So from a medical standpoint, as a physician, talk to me a bit about how things are in your country, meaning have things drastically changed in terms of how healthcare is looked at, and moreover, who is seen as a priority and who is not?
Basically, the healthcare system in our country, it is not totally supervised. There are insurance coverages through different health initiatives by the government, by semi-government organizations, but this is not a centralized way of doing things. So some of these health-related issues, they are covered under the government initiative through health, different insurances, through different health sector reforms. They are covered, like for diabetes, for hypertension, for ischemic heart diseases, for surgeries related to these issues. They are mostly or somehow covered under the insurance, but not totally. Same goes for breast health issues, breast cancer issues. Some part of it is covered, some of it is subsidized, and some of it patient has to manage on their own. So it all depends on the locality where the patient belongs. In the big centers, big areas, it is a bit easier to have access to the big hospitals where there are tertiary care facilities for the patients who are newly diagnosed or who are in their terminal stage due to any illness. So there are centers who are doing excellent work. They are providing all kind of health facility, but this is not a centralized or totally organized system. Somewhat haphazard. So patient needs some time, some assistance, and some guidance regarding where they have to go, where they have to get all the tests done, and where they can have their treatment done in an organized way with lesser or no cost on their end. So it requires a bit of time, bit of guidance on the end of the healthcare professionals, on the healthcare organization. But we are trying our best to facilitate patients as much as we can in the government
I
setup as well as in the private clinics.
I imagine so. I'm curious to ask you, when someone selects a good chunk of their time at being a physician, I would gather that they're motivated by some big driving force. So for you personally, what made you want to get into the field of medicine?
Basically, for me, it was something that was I had in my mind right from the start. My family has doctors, healthcare professionals, so it was a bit easy for me to make my mind towards this healthcare system. But I had to decide how and when I can manage my own time in the clinical practice, as well as I had this idea that something has to be done, especially for those patients, for those women, those females who are not in the screening group of any breast health or breast cancer issues. Like screening starts after the age of 40 years. The age group that is below this, below 39 years of age, this adult age group from 16 to 18 years till 39, they are not screened by any healthcare system in the entire world. Mostly the breast cancer screening starts at the age of 40 years. So what about these women? They are not given any guidelines. They are not taught about anything, how they can care for themselves, how they can prevent. It is not just about breast cancer. Breast cancer is like 1 in 10 lumps that are found in the breast are cancerous. What
Mhm.
about the other 9 lumps, the other issues that women, the young females face? Also, the concept regarding breast cancer awareness, it is beyond me because it is not just about cancer. You have to aware them about other issues as well. If someone is having pain, someone is having nipple discharge, someone is having infection-like tendency. So how they are going to adopt their mind to these issues, how they are going to equip themselves with the knowledge how to care for themselves. So to provide all this information, I had to gather all the resource from the internet. I made a complete website regarding this. And also I had to arrange all kind of uh, awareness sessions, coaching sessions, resource for that, for promoting it online. So everything was done after this uh, pandemic, especially for these 3 4 years. They were a real haphazard year for everyone, particularly for those who are not being screened by anyone. So
Mm,
to help them, to guide them, they need someone or some platform where they can have access to information, access to coaching, and access to the right information.
yes.
That's why that thing motivated me to initiate these all steps that I'm doing and practicing for a couple of years now.
Okay. Now, in looking at your resume, one of the things that stood out to me is usually a doctor will be strictly one area, one field as far as education. But for you, I noticed that you had a master in philosophy. So I'm wondering how a guy who becomes a doctor, do you need a master's in philosophy, or like how does that fit into the big picture here?
Well, that term is misleading in my context because it was a master in philosophy, but it had a particular research topic. It was
Uh-huh.
regarding obstetrical and gynecological ultrasound.
Okay.
So, in that research period, I studied about different aspects of breast health, obstetrical ultrasound, gynecological ultrasound. So, all these were covered under this. So, that was the degree title, but the actual matter is regarding the obstetrical and gynecological ultrasound, and mostly it is almost all thing is relevant to women's health.
Gotcha.
So that's why it is relevant, totally relevant.
Okay, that makes sense to me then. I get you. I also
Mm.
noticed that at one point in your career, you had done some volunteer work, which found you doing medical blogging. So I want to talk a bit about that. For you personally, when you are blogging or putting out information into the internet, a lot of us are very leery these days of what goes out there. So for you, how do you use that particular writing, whether it's a website, blogging, etc., to get your message across where people can understand? A lot of us are like, you go to a doctor and you talk to us like in another language. So how do you kind of put it in plain sense for us to understand and also make it believable for us?
Actually, it is all relevant to the work related to information, to awareness, because the thing we learn in the medical school and later in our university time and during our clinical sessions, those are those terms which are either we experience or we see in the patients, but not every information is relevant to every patient.
Hmm.
Every person is different, everyone has different issues, and most of the data, most of the studies that we have are done in the Europe or in the States. So for a person, for a doctor living in South Asia, those studies and those numbers may not be a total fit. So to provide an overall view, overall estimate of the things, like one simple clue regarding hormonal issues. So there are certain chemicals, certain skincare products, certain pesticides which are used in the South Asian countries, but they are not used in the States because they are banned there. So how come a person living in the States, they can do research on those things which are affecting health of women in the South Asia? So everything is relevant unless you are having a proper mechanism to guide these patients, these women, or in general population, that you have to be aware of what you are consuming, what you are applying on your skin, and how it affects you. Like a simple example, the microplastics. They are
Hmm.
present in those disposable cups, those disposable trays and plates, in which are used to serve tea, coffee in the cafes and the restaurants. So they have a layer, inner layer, which makes it impermeable. That is a plastic based layer that makes that cup impermeable to any liquid. And that regular use of that plastic can cause different health issues and also contribute towards cancer. So these information, these simple bit of information, if we are not providing to people who are consuming or who are in the habit of doing these things, they cannot be aware of what to do. So to provide this information, these missing links, these gaps between the information we know and the thing that they have to know. So to bridge this gap, something had to be done. So in plain, simple words, the best way is either through text or through the speech. So I try to use both.
Very, very smart there, I have to say. Now, again, looking at the current condition of healthcare, one of the things that I've noticed, and you can address this in your country, is somewhat of a hesitation to take care of ourselves, meaning that there's a generalized fear of going to the doctor, and then, of course, what's going to happen, especially with us having a pandemic like 2, 3 years ago. So, are you finding that women are becoming a bit more forthcoming about taking care of their gynecological work in general, meaning anything on that field? Are they more inclined to say, "Hey, I need to step up as they're aging, as new things are coming out, as technology's changing, new developments?" Has it changed in your country?
It is awareness changes everything everywhere. There are two aspects to it. One is having the information and awareness, and the other thing is having the resource to apply that information for the improvement. So in the states, in the Europe and different countries where the healthcare system is better, having a better system doesn't mean that a person is having all the access to that better healthcare, because they have to go through a process like through health insurance. Most of those fancy new treatments, they are not covered by health insurance in most countries. So having advancement in is another thing, and to have access to those in economical way, in a cheaper way is another. So most chunk of the population is not having access to those latest advancements, those techniques, those treatments, even in the West, even in the states. So awareness has created a lot of better mind, a lot of better sense in people, in women particularly, regarding their own health, self-care. But uh, there is still a lot to be done,
Hmm.
because the information that is available on the internet, it is mostly not credible, because it comes through random sources, through those websites that only feed data for the sake of generating revenue, not for the sake of providing proper information.
Mhm.
So having loads of blogging websites, it doesn't mean they are credible websites. So awareness in a right to information and having information is one thing, but applying it in a proper way and having access to the credible information is another. So
Mhm.
in misinformation and bad information, it is contributing towards ill health also. Because if you are giving simple tips, home care tips to women for their skin care, it doesn't mean that those skincare tips are actually helpful. They may contain those chemicals which are adding carcinogens to the skin. So, having this era of information, bombarded with information of all sorts, doesn't mean that it is providing all kind of help also. So, supervision is very important in everything. Unless you are supervising something, loads of information, it may be useless or may be harmful. So, it has helped in our country, in South Asia, to have access to information, access to the concept of better self-care, but
Mhm.
it has to be supervised.
Okay. Now, if someone happens to listen to an interview like this and you are a doctor, what advice or recommendation would you give to them when they are trying to vet through various doctors? What are the sorts of things we should be looking for when it comes to our own care as far as a provider goes?
Most important thing is whenever a person, a female or male or any person, they seek advice for something, they have a certain mind that they are going through a certain condition. It may be something that is temporary. It may be something that is having a long-standing history. So the best way is to write those points which they have in their mind, unbiased, without looking at the internet.
Mhm.
So the doctor, when they see those points, they can address those points that are only particular to that person, not the conversation, not the text they have read somewhere in the internet, or heard from someone who was going through same symptoms, but their mind and their body is different. Their
Right.
mind and their body responds differently to those signs and symptoms. So they don't have to listen to anybody. They just have to write those points, go to a doctor, try to ask those particular questions they have in their mind regarding their own health. If they are satisfied by the answers, give that doctor a time to treat those to cure those issues, because there is not a magic pill that will sort all these issues right at the moment that they ingest something. So they have to give time to that person. If those symptoms are worsening after the treatment, and if that doctor is unable to provide them with a proper explanation why this is going on, then
Mm.
they can jump to another clinic, jump to another opinion, but without giving a proper time. Because simple aches, simple body pains, they are simple to treat because they have only a single factor that is causing those.
Okay,
But for chronic illness, it is a body is interlinked. All the systems are connected. So the doctor takes time to sort out all those issues that are going on in the background, and then he can provide you with the information and with those treatment options that can help you in a combined way. So if a person is seeking a certain miracle, then it is hard for them to be satisfied by any person.
sure.
So they have to be considerate about this, that medicine or any treatment, it takes time, because any sudden remedy can be harmful, because it
Uh,
will stop something to happen to create those magical results, and
mhm.
stopping a process can be damaging. You have to gradually increase or decrease something for it to last for a longer period of time in a safer way.
Okay, gotcha. I want to talk a bit about some of the research I did relative to breast cancer. One of the things that I found recently was that, and very recently, apparently there's a bigger rise of patients who are both Asian and Pacific Islander that seem to have an increase in breast cancer results as of late. So, as far as Pakistan goes, are you noticing the same trend as in numbers are rising, and any suspicion on why that might be?
In Pakistan, the worst thing that is happening in Pakistan is that the healthcare system related to breast cancer screening and breast cancer case reporting, this is not a centralized system. Almost 20 to 30% of the population that is living in very remote areas where there is no centralized healthcare system. They are not screened by anywhere. They are not having access, easy access to those facilities. They have hospitals which may be 100 or 200 kilometers away from them, 100 miles away from them. So access is not available for every female, every person. So there are difficulties in having access to proper diagnosis, access to treatment, and access to follow-up. We have a lot of patients who are in the younger age group, like in the 20s and 30s. And this is a very alarming trend. Globally, it is thought that breast cancer usually occurs after the age of 40 years. That's why screening starts at the age of 40 years through mammograms. But this age group, or in the 20s and 30s, it is getting increased number of patients at an alarming rate with very aggressive cancer, not just in Pakistan, but in different countries also, even in the States.
Mhm.
The data that I read a couple of years ago, it stated that the breast cancer is becoming the highest, the leading number of patients and the deaths due to cancer are due to breast cancer in younger females below the age of 39 years. This is a very alarming trend. So it is a problem that is a global problem, not just in Pakistan. Globally, this trend is happening, and there are some factors which are contributing to this, not just in Pakistan, but in developed countries also. Sedentary lifestyle, bad food choices, bad emotional health, bad sleep routine, and also lack of proper self-breast care.
Hmm.
These are the factors that are causing increased number of breast health issues, breast cancer issues in the 20s and 30s. And sadly, this number is also present. The small number, even 5% of cases are in the late teens also, in the 18, 19, 20 years age group. This is a very dangerous stat. And mainly this is cause nobody is screening these girls, these women, these younger women. Nobody is screening them. Nobody is telling them that they are at a higher risk just because of their bad choices, bad information provided, bad lifestyle, and uh, this current scenario of sedentary lifestyle. It is contributing very badly, and these numbers are alarming. And like we are getting these cases now, their data will be published after 5 to 10 years. The problem with the statistics is that the data is collected for 5 to 10 years and then it is presented. So in this time, this rapid change, the rapid surge of cases right after the pandemic, due to the sudden sedentary lifestyle, sudden emotional health issues, sudden reduced screening, even in the states, those screening process that almost halted. Only emergencies was taken in the different clinics and hospitals. So that lag, it is leading towards and contributing towards more and more cases which are less screened and which are diagnosed at late stage, and they are causing increased number of deaths just cause of late diagnosis.
Jeez. So before we start talking about some of the things that you were doing to try to prevent more and more people from not getting diagnosed the right way, or not getting treatment, I want to ask about this. I just read about this today. There's a new development. Apparently, there's a new immune system target that will head off the spread of breast cancer cells. I don't know if you've read that yet or not, but I'm curious to ask you if you think some of the research that we have been doing in the last maybe even year or two, 5 years or so, are we making significant strides? Do you feel we're getting steps closer to maybe not necessarily a cure, but maybe more prevention?
Actually, the first thing that every female, every adult female, every 15 to 16-year-old girl, and later in any age group, they have to realize that there are few factors that every female has which are contributing towards breast cancer. Like estrogen hormone is one of the main hormones that cause all the changes in the female reproductive system, the breast, skin, hair texture, the skin tone, their mood, their emotional health, their menstrual cycle. So it is all almost controlled by the estrogen hormone. That hormone is directly responsible for increasing breast cancer risk. So these risks are present with every female. They are some are having more, some are having less. Their emotional health is another. Their bad lifestyle choices, their diet, because we can make drugs to cure things early, but to get a cure, we have to detect it early. So for detection, screening is very important, but we are not screening before the age of 40 years. So how we are going to provide a better chance to these girls, these women, when they are not screened? So the first thing is to get early screening, not just through mammograms. Mammograms are almost uh, half a use in the younger girls due to their breast density. Mammograms don't detect almost half of the small lumps in women, even in the age of 40 or 50, because due to high breast density, those women, almost 30 to 40%, or even 50% females globally in different area, you can say, they are having dense breast, more or less dense breast. So in a dense breast, it is very hard to detect small lumps. And mammograms, they are unable to have proper screening in this younger age group, even in the 30s and early 40s. If we are not able to screen them, we are not able to detect small lumps, how we are getting a proper treatment for them in the early stage? So just by mammogram, screening is not useful. You have to add two other modalities on a regular basis to promote early detection. One is ultrasound. Breast ultrasound can be done even a 15-year-old girl in an 18-year-old female. So it is a very easy thing without any radiation, just a 5 to 10 minutes procedure, and you can detect small changes. Even small lumps, they can be detected in a girl who is having no symptom at all, no family history, no other risk factors that are obvious. But if she is having a lump, it may be a benign lump without any cancer, but having the information that there is a lump present makes her aware that she has to make a better lifestyle choices in her later life. Because those factors that made a lump in the breast, it may be a non-dangerous one, but those factors can contribute to forming another lump which may be cancerous. So to be aware, to have the information, and to be in the screening through any process makes them better aware of how to care for themselves. So unless we are screening them, unless we are providing them an option that uh, they can detect something that is going on. And the third and most important thing is self breast awareness. That is the concept of knowing her own breasts. It is not just about touching the breast to find a lump. Lump is one component. There are 9, 10 other components regarding breast self-awareness that every female should learn in her high school, in her college, in her university. And by the time she is a college graduate, she should be able to guide and teach others who are younger to her, because it is a chain process. Unless you are giving them enough information and providing them with the motivation that your example will help others also. So unless you are providing the information and motivation for them to help others, it is a useless exercise to
Mm.
just give them a message in the month of October that go have a mammogram or have a self breast examination yourself, because that examination just by palpation is only 10 to 20% of the step. So we are not providing them with the proper information. We are not teaching the exact method that is helpful for them. So unless we are giving and keeping this mind, all these aspects, it's a useless exercise.
Gotcha. Now, would you speak a bit about this because you're mentioning about younger girls, things like that. How receptive do you find high schools and colleges and places, all the educational facilities? How receptive are they to wanting to teach this sort of thing to the various girls that are there?
In some institutes in Pakistan and even in the Europe, they have a separate program. They arrange programs and classes in the colleges and universities regarding breast cancer awareness. They provide them with a bit of stats that something is going on. They have to be aware. But the wrong figure they quote is the breast cancer is a disease of the 40s and 50s and later. So and they are providing them with information which is not relevant to them. The concept and the basic literature we have available at the moment, all those guidelines, they all only say check yourself by palpation
Hmm.
and get a screening mammogram after the age of 40 years. They
Hmm.
should know that they have to monitor themselves on a regular basis. If one day they check themselves in the mirror, even a 20-year-old girl, if she sees there is a mark, there is a bump on the breast or the nipple, if there is redness in any part of the breast, if that feeling, that ache persists for more than 2, 3 days, and its intensity is increasing, then it should alarm her that there is something going on. Not necessarily breast cancer, but it can be an inflammation, it can be infection, it can be something. It
Yes.
can be a blocked duct in the breast that is causing these issues. And on a monthly basis, she has to do the detailed breast self-examination. That includes the visual examination as well as through palpation. Press in a circular way and check if you find a lump. Lump is one finding. You have to also check in the in this method, in the vertical method, and in like the clock 1, 2, 3, 4, 5, 6, 7, 8,
Okay.
the clock faces.
Hmm.
So these three methods, if it feels more stiff, more irregular, more bumpy, if it is having a consistency like a cord, like straws placed together, if you are moving fingers on it, if it feels like cords around right under the skin, and that thing is not present in the other breast, it means there is some change in this breast, in this particular area, that is not present in the other. Even she is an 18-year-old girl. She should have the right to get proper investigation. It may be congestion in one side of the breast. It may be fibrocystic changes. They are hormonal induced changes in the breast. It is not just about finding a lump. This is the only thing I always tell my patients and every person that I teach online, not just to find a lump. You have to be aware of yourself, what your breast felt like a month before and how they are feeling now. Is there any difference? Is there any point, any specific area where there is difference? You have to mark it, you have to note it, and compare it the next month also. Everything is relevant. You have to be aware what to check for, what to look for, and what things to note down that you have to check the next month also.
Hmm. Looking at someone like myself, let's say, who's in the mid 50s range, a lot of us have either been post or premenopausal or even in menopause. So, for women like us, are there just certain things that we should be more hyper aware about because of our age, because of changes in our hormones? Because we all know they go crazy at this point. Are we more susceptible to certain things?
Every age group has different health issues, health concerns.
Hmm.
Like in the late 40s and 50s, the estrogen levels are going very down, very low. So
Okay.
it leads to changes in the skin texture, it leads to changes in the hair density, also the overall bone density also. Same goes with the breast tissue. The breast glands, they reduce, the fats remain, so the breast consistency change, the breast density changes. So if a person in the 50s, early or late 50s, or even in the 60s, if during a detailed breast self-examination, if they find that one side of the breast or one breast area or one whole breast, it feels different than the other, it means that there is an irregular pattern of change in the breast. If the breasts are not properly supported by an appropriate bra, it will hamper, it will alter the normal blood circulation as well as lymphatic circulation of the breast. It can feel more painful, it can feel more heavier if that breast and or that part is not having appropriate circulation and drainage. The main concept is to have a regular assessment of the breast every month, because any change that is sudden, that is rapid, it should alarm any person. The best way is to know which food items are good for you. In the younger age group, everything body can accept, everything body can process.
Sure.
But as the metabolism slows down, you have to provide your body the nutrients that are deficient in the routine diet.
Okay.
Like calcium is required, vitamin D, sun exposure is required.
Yeah.
It helps in boosting immunity, it helps in reducing the risk of breast cancer, it helps in promoting bone growth, it helps in providing overall immunity towards different viral infections. Every age group has different challenges, every age group has different kind of body requirements. So every person needs to learn which nutrients they require in their particular social setup, in their particular lifestyle, and in their particular age group.
Got it. Okay, gotcha. So I want to talk about the last year and a half. You have started an organization called Be Breast Aware. So I'd like you to tell everyone a bit about what you do through this organization. And so far, what have been some of the most amazing accomplishments you've done so far through this?
The best thing that I feel proud of is establishing the website that has all the information that is available on the internet. It is among one of the leading websites which has all the information packed in it regarding breast health, breast cancer, treatment guidelines, and everything. And the second thing I did was to make it accessible in my own language, Urdu.
Ah,
So it is you can translate it in both languages. The other thing I have tried is to publish booklets regarding breast health awareness. It is both in Urdu and English, both languages. It is free download. They can go to the website and they can download it. It is
okay.
all the basic information regarding breast self awareness, what are the components of it, how to do a detailed breast self examination, the steps are, and also I arrange regular online training sessions, group training sessions for breast health awareness, breast cancer awareness. I volunteer in few groups where I provide free of cost information, guidelines, trainings regarding breast health, breast cancer awareness. And I'm part of Global Care Concert. It is a Florida-based health setup,
Oh,
mainly to focusing towards women health coaching. So I'm working there as a breast health coach and also ultrasound consultant there. So this is all an online platform where women contact for their breast health issues and also for a second opinion regarding their ultrasounds, regarding their breast health, and even obstetrical and gynecological ultrasound. And the one particular thing that I'm trying to educate and coach is regarding how to reduce the avoidable risk factors for breast cancer development.
hmm.
It is a complete program where I guide them regarding their own health, regarding their age group, which lifestyle choices, which emotional health uh, changes, issues they have to overcome to reduce their risk of breast cancer. There is a free assessment questionnaire I have developed. in that website where any person, any female can go and they can answer 31 questions, which are linked with assessing how much risk factors they have regarding breast cancer. So once they know which factors they have to overcome, then I can help them in reducing those factors, overcoming those issues which are avoidable. Because some factors are unavoidable, like having a genetic makeup or having a gene mutation. It is an unavoidable thing. Lifestyle choices, exercises, breast massages, those skincare products selection, those dietary modifications, those emotional health issues, all these I can help them. Just they need a motivation, proper awareness, and coaching. So it can help them, any female in any age group, it can help them in reducing the avoidable risk factors.
Okay. Now, if unfortunately some of us get that call one day that says to us, you have breast cancer, obviously there is that word in and of itself is just enough to bring fright to women. It's enough to scare them. It's enough to say, maybe I don't want to treat this, etc. What would your advice be to them in terms of taking that journey? Because sometimes, as I understand it, there's more hope there than you might think.
Definitely. Like the life expectancy of a female having a stage 1 or stage 2 breast cancer diagnosed, it is more than 90%. Like
Wow.
for stage 1, it is about 95% cure for more than 5 years or 10 years survival rate. So it is a very good number. But to have that diagnosis of stage 1 and stage 2, it is important that she does her breast examination on a regular basis, and she seeks advice the minute she finds something different. And the healthcare system provides her with the tool to detect it early, not just the mammogram. Healthcare system should offer her breast ultrasound and
Hmm.
MRI if that is required. Because if a girl of 28 years of age, I have seen patients in their early 20s, and one of them even died due to breast cancer at the age of 25 years, because nobody was listening to her when she was telling she had a lump. Everybody just said, you are too young to have a breast cancer lump,
Hmm.
just ignore it. And the time when it was biopsied, it was stage 3 lump, which he couldn't get treatment completely because it was already advancing. And in younger girls, it is aggressive cancer in most cases. So it is hard to treat. For any person to have a complete cure, complete treatment, it is very important to get it caught early, to get it treated early. So in stage 1 or even in stage 2, the chances are very high, very good. Most of these cancers of any strain, any type, they can be treated with a life expectancy of up to 90%, 95% if it is treated in stage 1 or stage 2. Even
Okay.
in stage 3, she can have a very good chance of getting a treatment if it is treated properly, in a good setup, in a good care, with a proper support system of family, friends, and healthcare professionals. She can have a life expectancy in more than 75% of cases. But it gets trickier and very hard to treat a person in stage 4 who has breast cancer cells and other metastatic cells in her liver, in her bones, in her brain. Then it is very hard to cure. It
Sure.
can be reduced, its spread can be reduced, it can be minimized, but it is very hard to treat. So then the life expectancy 5 year survival rate goes down up 30%, 25%. It
Right.
is a bad number, but still, to treat it early, to get it caught early, every person, every female has to be self breast aware, and the healthcare system should provide her with at least an option to get an additional breast ultrasound in addition to breast mammogram.
Okay. Now, if we don't live in Pakistan, which a lot of us do not, and they still want to work with you or see you in some way or get your knowledge or information, are there virtual ways to do that with you, doctor?
Definitely. I opted and I chose this online medium just because everybody can have access to it. Most of the information I provide on a regular basis through different Facebook groups, through different WhatsApp group. I'm part of those. I volunteer there. Patient take online sessions with me through Zoom, one-on-one sessions they ask for. So most of the work that I do is free for everyone, like in
Okay.
the groups, in the group training sessions.
Yeah,
But now to provide them with all the personalized options, those one-on-one sessions, they are paid, but the most of the information, it is free for them. The
nice.
personalized thing that requires their personal information, their personal one-on-one interaction with me. I have to understand their issue, to address their concern. So it takes time, 1 or 2, 3 sessions, 1 hour or more. So those are paid sessions that anybody can have. But in a group session, any person has access to all the basic information, basic knowledge. They can contact me through Facebook. They can contact me through LinkedIn. I'm available there. So this website is the best thing they can have access to. They can download the booklet. They can fill up that questionnaire. So there are numerous ways they can get help, not just the paid ones, but also the free ones.
Gotcha. Now, are there any upcoming events, conferences, places that you personally are participating in or lecturing at, or anywhere where people can go to see you?
There have been 2, 3 virtual events that I was part of. One
Okay.
was in UAE, the other two were held in the USA. So
Okay.
there are regular online TV shows that
Okay.
I'm part of. In Pakistan, I'm part of a few radio station shows. There are different uh, invitations that I have to prioritize depending on my own clinical
Yeah.
setup and my own work that I do voluntarily and also online. So there are many projects in the pipeline. So let's hope more and more stuff is I can provide them more and more information.
That would be lovely. And I don't want to forget to mention again, his name is Dr. Jawad Mustafa. The name of the organization is Be Breast Aware, which you can find. Also, the doctor himself, he's on Facebook, he's on LinkedIn. And do you have a personal website as well, doctor?
Yeah, my personal website is under development because there are few training programs I'm starting regarding breast
Okay.
self-awareness, breast cancer awareness, and also regarding different food items that are helpful, food items and lifestyle choices, and also the cosmetics and the daily use carcinogens that are present in our food, present in our cosmetics, in our pesticides and everything. Hopefully, it will be launched in a couple of months.
Wonderful. Doctor, I think I speak for all of us, whether I'm in the US, Pakistan, or anywhere else, when I say that it is so inspiring and moving to see one person take so much of their life and dedicate it to something so very important to so many people. So, on behalf of everyone, I thank you so much for all of your contributions. You're making a world of difference across the country. So, thank you very much, and thank you for your time here.
Thank you for having me. And just one thing I want to tell everyone that there is always information that is helpful. Be aware, know what is good, what is bad for you, and make better lifestyle choices. Because those choices you make, they affect your past, present, and future, and also those inspire the ones that are living with you, those your loved ones. Either they inspire those, or either they make them fearful of things. So inspire them with the good things and give them a better example of what to do and what choices to make.